I've just entered the hospital. When we enter the hospital first time, we're always washing our hands, so I've done that. I'm now going to check my orders. I've seen that the patient has an order for NG suctioning. So I'm going to gather the supplies to do that. I'm going to get an NG suctioning kit, an emesis basin, a washcloth, some lubricant, and some sterile solution. I've gathered all those things, and now I'm going to enter the patient's room. Hi there, my name is Jay. I'm a student nurse. I'm going to be taking care of you today. For hand hygiene. Can you verify your first and last name for me, please? And your date of birth? And do you have any medication allergies? Right, can I see your wristband?
Yeah.
Great. Checking that against the mark. For hand hygiene. All right, well, the reason I'm here is I understand you were having some trouble breathing due to some congestion, so the doctor's ordered some NG suctioning for you to hopefully get you breathing a little easier, all right? All right, so I'm just going to go ahead and assess that the patient does have a need for this procedure. So the way I'm going to do that is by asking them how they're breathing, listening to the lung sounds, and then also just assessing the nares, doing a quick check in the nose, making sure there's no obvious blockages, anything like that. And then I'm going to establish a baseline by looking at the pulse oximeter, seeing what their oxygen is at now. All right, so I've established that yes, the patient is having some congestion. They've got a need for this procedure, so we're going to go ahead and get started. So the first thing I'm going to do is dial up the patient's oxygen a little bit from their ordered oxygen, just to get them saturated, because the mask is going to come off a little bit, so a little bit, about half a liter above whatever's ordered. I'm then going to get the suction going between 80 and 120 millimeters mercury, and then lay out the suction tubing by the patient's bedside so it's ready to go for me when I need it. All right, so now I'm going to go ahead and give the patient a washcloth over their gown just in case they cough up a lot of stuff. Keep them nice and clean, and then an emesis basin as well in case they need to spit into that. That's all set. I'm now going to start preparing my sterile field for putting together the NG tube. So I'm going to make sure this table's at a good working height for me. Sanitize the table. Also, make sure the bed's a little higher up, just so I'm comfortable working with the patient. That's good. Now I'm going to gather my suctioning supplies. So I've got sterile saline solution. I'm going to double check that that is not expired. It's all good. Got lubricant. And I've got the actual NG suctioning. I'm going to grab my hand sanitizer just so that I have it readily available. Keep myself extra nice and sanitary. You can never perform too much hand hygiene. Alright, so now I'm going to proceed with opening the NG suctioning kit.
Yeah, I mean, I haven't started with it. I haven't done my first one yet.
Alright, I've got the suction kit out. I'm now going to open it, grabbing only the sides, and be careful not to go over the kit to maintain a sterile field.
I think you terrible. Bring your what is in our spray system. I think the several qualities. That's good. So that's good. Keep going with it.
I'm going to remove the small basin that you pour the sterile saline solution into. And get that set up. And I'm going to pour about 100 milliliters of water or sterile saline solution into the basin. I'm going to pull my kit open from the outside only, taking care to maintain the sterile field. I'm now going to take my lubricant, put a little vial of lubricant on the side of the kit so it's ready. And now I'm going to perform hand hygiene again just for extra good measure. And don my sterile gloves. Put my hands to dry for a second. All right. So, I'm going to don my first glove, grasping it only by the cuff, putting it onto my dominant hand. Going to loop into the cuff of the second glove and don that. I can now, this hand is sterile, so I can adjust the top of this glove. And I'm now going to remove the NG tubing from the sterile kit. I'm going to put the tubing securely in my sterile dominant hand, come over to the NG tubing, grabbing the NG tubing with my now non-sterile but clean non-dominant hand, putting the two together. I'm then going to test the suction of the tubing, just sucking up a little bit of saline solution. It's working. So now I'm going to dab the suction tubing in 2 to 3 inches of lubricant. Head on over to the patient. I'm going to assess for the appropriate suctioning length by approximating the distance between the nares and the mandible. It's going to be about 4 to 6 inches depending on the patient. I'm now going to take my clean hand, remove the patient's oxygen mask, and then perform suctioning, inserting the suction tube without suctioning, and then pulling it out, intermittently suctioning while twisting, taking about 15 seconds to perform the entire procedure. I'm going to encourage the patient to cough, get as much junk out of there as we can. I'm going to wait a minute, reassess the baseline, check the oxygen, make sure it's okay. I'm going to rinse this tubing out with the saline solution, and then repeat the procedure on the second nair. Inserting without suction, coming out, twisting with intermittent suctioning. Again, reassess, encourage the patient to cough, check oxygen, ask him how he's breathing any better, listen to the lung sounds, determine that indeed the patient is breathing better. So that was a success. So we don't need to suction anymore. We're going to go ahead and wrap the tubing out, or clean the line out, just to get all the junk out of the line so it's ready for the next time. Wrap the tubing in my sterile gloved hand, pull it off, remove my gloves properly, dispose of them. I'm now going to perform some hand hygiene. Get that patient's mask back on. It should be off for as little time as possible. Now the oxygen back down to whatever was ordered, back to the baseline. Put the suctioning tubing away, turn it off. And now we're going to perform some oral hygiene on the patient. So I'm going to don just clean gloves. I would get a toothbrush and a basin, get the mouth nice and clean. Perform oral hygiene. That's all good. All right, now we're going to get rid of this emphasis space in the washcloth. This is going to the laundry. I am going to dispose of the rest of the kit. Gather my supplies, check on the patient. Need anything else? Are you feeling better? Check their pulse ox one last time. All right, if that's all, I'm gonna be back in about an hour to check on you. Get my supplies and ensure that the bed is all the way back down. Make sure the patient's comfortable. Point out that their call line is here. If they need anything else, they can call me. Otherwise, I'll be back in about an hour to check on you. And exit.